again for this issue. For the panel discussion, we have the speakers again, and we're joined by Dr. Stephan Theis, Head of Nutrition Science at the Südzucker Group. And we also have Professor Anette Buyken from University of Paderborn in Germany. And I'm going to start right away because the time is already ticking. And I'm going to start with the first question. As we heard today, the poor glycemic control is implicated in the development of chronic metabolic diseases, decreased cognitive function, and even an altered immune response to infection. So what would you see this as an opportunity for the food industry to innovate and come up with new food products by targeting glycemic control through healthier food and healthier ingredients? So maybe we can start with you, Dr. Stephan Theis, as an industry representative.
Yeah, thank you very much, Matt. And just perhaps to make a proposal at the beginning, I could imagine that there are many burning questions to Norbert, Stephan, and perhaps we can use the chat function to address these questions to Norbert, Stephan, and they may be answered via the chat function to the audience. Yeah. So just a suggestion right from the beginning. And now coming back to your question, yes, definitely. I think there is a lot of innovation potential also to the food industry, looking at all these data that was presented today, but also data that has been reviewed, for instance, by the ILSI Europe Carbohydrate Task Force, showing that improved blood sugar management is or can be considered as more important than ever. And I think that's not only a topic for the research, but I think that's also a big topic in the consumer's mind now. Yeah, and I would like to refer to own consumer research conducted by Vinoy, showing that the majority of consumers find it quite important that food and drink products they choose are also assisting in blood sugar reduction. Yeah, so there's a certain interest in the blood glucose management claim, and this interest is changing. People are also, based on this new data, are realizing that it's just not for diabetics only and for treating of diabetes. And I'm pretty sure that also product development, food product development will catch up. And I'm pretty sure that we will see in the very near future also a lot of products on the market tackling blood glucose response.
Okay, thank you for the answer. Does anybody else have something to add to this? Yes, Louise, go ahead.
And I think, Stephan, that's a really important point, because part of the pressure now that is coming from governments and health organisations is to reformulate products. But there's also quite a lot that one can do within a natural diet. So, for example, we know that increasing dietary fibre has a positive impact on glycemic response. But it's then about how we make those things palatable. Yeah, and then, you know, notwithstanding my slide that showed that palatability could increase glycemic response, of course. But there are things that one can do within the normal diet. And I think that Ellen also showed the power of some of that feedback that can be given to normal consumers about what's happening with their glycemic response by using the continuous glucose monitoring devices, etc. Because none of us actually perceive a change in our glycemic response. It's not conscious. So we do need some feedback, and we need to educate consumers about diet in order so that they can make the right kind of choices.
Yes, I fully agree with that, with the previous discussion. And indeed, I think that's an important point also when consumers become aware of healthy blood glucose control, and that also may affect how they feel, for instance. So just perceive the benefits of that. I think that may be very motivating also to consume a healthy diet.
Thank you. And maybe if we go ahead, Anette, you wanna add something?
Yes, I wanted to add something, saying that maybe at the moment we're very much focusing on sugar only. which is good for many reasons. But I think we need to make consumers aware, or everybody should be aware of the fact that when we're tackling that, that doesn't necessarily reduce postprandial glucose, especially if we then eat starches that contribute a lot to the rise in glucose. So there's probably something that we should be doing about it. And at the moment, reformulation isn't really helping because that would not directly address that. So if possible, it would be good to have an additional labeling or expand current labeling that we are considering by taking into account how postprandial glucose is reacting to the carbohydrates in the product.
I think that's an interesting point. Maybe I will follow up with you on this. So it seems like in terms of public health perspective, what do you think we will need in terms of governmental action to improve glycemic control or in terms of prevention? So you mentioned labeling. We know that there's already the Nutri-Score is something that seems to be in place in Europe and is growing. So do you think the Nutri-Score should maybe incorporate something about glycemic response?
That's a possibility that we should perhaps explore a little bit more. I know that there's also ideas to really have a glycemic index logo on top of that, which is of course not possible at the moment in the given food regulatory system that we have in the EU, but that could change in the future. And to see whether that could be incorporated into the Nutri-Score would be a possibility. I think it's also important because we're now more and more aware that because of all the planetary health discussion that we will have to eat a lot of carbohydrates in the future. They will have to be a major component of our diet and probably even a more important component of the diet in the future. So we need to pay more attention to good carbohydrates in that context. And perhaps that's a possibility, even though it's probably complicated. So I don't see any regulation in terms of taxes or something like that at the moment because we don't have the evidence for that. And but labeling would probably be the most important issue that we could tackle. And when I go back to Louise Dai's comment, also when we talk about consumer awareness, we could also talk about what's being served in communities, what's being served in hospitals, what's being served in canteens. That if we could have a change there in what is being recommended at the moment, that would probably also move public health forward.
Okay, thank you. Yeah, it seems like the consumer is basically at the end of the chain. It's consumer behavior, understanding consumer behavior is key in this. So, maybe a question more directed to Professor Dai. Do you know, or do you think there's a better way to communicate this information to consumers? We mentioned the label, but we all know that labeling is probably not working as it should. So do you have any insights?
Now, I think one of the things that we have learned is that education doesn't change behavior, or information doesn't change behavior. People need to do, what we need to do, speaking as a psychologist, is we need to make the desired behavior the one that is the easiest to enact, to engage in. And that might mean that we make the price reductions for foods that are positive bigger. You know, even in a supermarket, the profit-making products are the ones at eye level. Yeah, so there are things that we can do in the environment, in the retail environment, but we can also do things in the external world. And I think Anette's point about hospital food, school food, those kind of things where kids are exposed to things that they would not be exposed to, for example, in the house. So mothers only feed children food they like themselves. They don't experiment with exposing them to other foods. And perhaps we need to find ways of doing that. So I think there are lots of creative things that we can do, but just giving people information is not going to change their behavior. And we really have to wake up to that.
Thank you.
The consumers need to be given possibilities to really catch when they are at the supermarket shelf, to really identify products which could contribute to their blood glucose management in an easy way, in an easy depictable way. So I think that's also important when we are talking about manufactured food products, so beyond the diet. And I think that's important to use the possibilities with a regulatory framework which is already in place, but then of course also considering the ideas that Anette mentioned, talking about a Nutri-Score Plus, where also the quality of carbohydrates is more taken into account than it is currently, where it is also only discriminated between sugars, less sugars, and so on. And I think that's really from a physiological point of view and what we know about the quality of carbohydrates, not really the best information that we could provide to the consumers. Yeah, when it comes to blood glucose response, etc.
I think as well, we need to think a little bit. I wanted to go on to, I know Professor Stephan cannot say much about COVID, but we will have an awful lot of people who have recovered from COVID, but who, based on his talk, are suffering some metabolic consequences of that exposure. And I think most of us now agree, even with vaccinations, COVID is going to be around for a long time. So we need to think really about obesity prevention, but also one of the things that's becoming clear in terms of long COVID is the impact on energy, on well-being in those individuals, and we even see some cognitive effects now of long COVID. So I think we need to be thinking very carefully about how we can make good dietary recommendations for individuals as they try to recover. And that might mean opening up to other nutrients that have some benefits. There's been some interesting data suggesting positive effects of polyphenols on cytokines and in a post-COVID situation. So there are some tantalizing things out there that we might be able to use in order to try and combat the longer term effects of COVID.
I fully agree with that. Of course, and there's a lot of attention nowadays for a healthy lifestyle, and we have to look for additional strategies, perhaps, to also let people adhere to a healthy lifestyle, because it's not only delivering the message. But just to expand a little bit then, because so far it has merely addressed also the public health perspectives or the general population. In science, at least, there's a lot of attention also for more personalizing or precision-based that can be based on someone's metabolism, but that also can relate, of course, to personalized delivery of advices. It has several aspects. So I'm just wondering, how do we see that? Because I think it's upcoming in a lot of scientific initiatives. So I'm also interested in the industry view on that, Stephan. Perhaps you can comment on that.
Yeah, I think personalized nutrition is definitely not only a major or a big trend when it comes to research, as you mentioned, but I think it's also one of the big trends that you see in the food industry tackling on this whole development in the area of personalized nutrition. And yes, I think indeed we have already now possibilities with different ingredients available to really address also those individual phenotypes that you were referring to and so on. So there's already now with carbohydrates that are slow release, that are low glycemic, or carbohydrates that do not provide any blood glucose response, or different aspects of dietary fiber and so on, or look at the area of microbiota and prebiotics. There are already tools available now to address this new area of personalized nutrition, and I would expect that more is still to come also when it comes to products targeting either individual consumers or targeting also specific subgroups or phenotypes, of course.
Mm-hmm.
Thank you. I think I see Professor Stephan. Can you hear us? I think you wanted to react, or?
Yes, I wanted to react to the COVID story, certainly because it was my talk. I just want to point out from the aspect of a physician dealing with patients with diabetes. So the COVID pandemic now is actually the ideal situation to change eating behavior for many people, because for the patients it's very obvious, so they can acquire the COVID disease tomorrow. And so always when I leave my office, talking about myocardial infarction, something that's way out there for them. So catching a severe COVID is imminent for them. So people go out of the office and say, I want to have my HbA1c down, I want to have my glucose down, I want to be healthy, and I want to get lean as quick as possible. So we're talking about days and weeks, and not as we did before, months and years. So with the COVID pandemic, we have the opportunity to really make the point that a healthy lifestyle, particularly in respect to obesity and glucose, now it's the time. It was never more imminent before. So that's the motivational aspect. And then I would like to add a little bit on the very good discussion we had before. So how can we motivate people? How can we influence politics? I just want to remind that our children and youth, so they are doing that already. So they have discovered healthy eating. They have discovered exercise. They have discovered the slow food and vegetarian aspects. So I think that we should not forget about that, because they learn from heroes in the media, and they are doing the modern lifestyle. So I think getting in touch with our older patients and motivating them about this new trend of healthy eating, I think would very much add, because at the moment the young children are actually staying at home and cooking healthy dishes, and I think a lot of people are surprised that you cannot regulate a lot by politics. The media and the heroes and the influencers are doing that job already. So I think it's just that we can combine this new trend that a lot of young people are following with our patients who actually have their way of living.
Okay, thank you very much for this very nice discussion. Unfortunately, we're already running out of time. So I really want to thank our speakers, so Professor Blaak, Professor Dai, and Professor Stephan for those very interesting talks. And also thank you to Professor Buyken and to Dr. Theis for joining for this live panel discussion.